I will take 45 minutes, more or less.
Sure. As you feel convenient. Definitely. So, Vinay garu, can we?
Okay.
So may I go live?
Yeah, please.
Yeah.
Sabhayai Namaha. With a prayer for everyone's well-being, we begin the session. Om Sarve Bhavantu Sukhinaha, Sarve Santu Niramayaha, Sarve Bhadrani Pashyantu, Ma Kashchit Dukkha Bhag Bhavet. Om Shantihi Shantihi Shantihi. Greetings from the Department of Sanskrit Studies, School of Humanities, University of Hyderabad. I, Vinaya Ballakur, visiting fellow at the department, welcome you all to the fourth lecture in the Tadvidyasambhāṣā series of lectures, an endeavor by the head of the department, Professor G.S.R. Prasad Garu. Mental health issues are on the rise globally due to a fast-paced lifestyle and competitive culture, and also due to lack of spiritual and materialistic balance in life. Ayurveda adopts a body-mind-soul approach towards life and mental health. Sattvatma shariram cha trayametat tridandavat lokas tishtati sanyoga tatra sarva pratishtatam. We are glad to have Professor Antonella Delle, Fave, Professor of Psychology, Department of Pathophysiology and Transplantation, University of Milano, Italy, who will be speaking on mental health in Ayurveda, suggestions for psychologists. It is going to be a contemporary take on ancient Ayurvedic wisdom in tackling mental health. I request our head of the department, Professor G.S.R. Prasad Garu, to welcome the guest speaker and the distinguished speakers in the audience.
Thank you, Dr. Vinayaji. Namastabhaye, Sarvebhyaha Swagatam. A very good evening to all the delegates of this wonderful event. I welcome Professor Antonella Delle, Professor of Psychology, Department of Pathophysiology and Transplantation, University of Milano. I know Professor Antonella for more than 8 or 10 years. In one of the conferences in Europe, Riga, wherein Professor Madanji is also participated very actively. We met each other, and I get to know about her research and interest in Ayurveda. She has been working in Ayurveda for a long time. I think very soon Professor Antonella will be introduced by Dr. Ramya. We'll get to know more about how she is involved in the Eastern medical research, especially in Ayurveda. Being a psychology professor, how she is into Ayurveda, how she has been working with Ayurveda scholars in India. All these things will be, intimated by Dr. Ramya. So there, I had active interactions with Professor Antonella ji. I was really fascinated to know about her views, especially from the Indian perspective. And a lot of these things were discussed. That time I presented a paper in mental health in Ayurveda. And being a professor in psychology, I had a chance to interact with her, to get to know more about the modern aspects of psychology, how those things can be meaningfully observed in Ayurveda. So that is how we got in touch with each other. Some 4 years back, when I contacted her, asking that whenever you come to India, please visit our university to deliver a distinguished lecture. She said yes, sir. Later on, COVID and all happened, and there was some time lapse. But somehow I could able to revive the contact with her recently in this context. So she kindly accepted our invitation to deliver this wonderful lecture on mental health in Ayurveda, suggestions for psychologists. So two different disciplines. There is a convergence between these two different disciplines. There are today my colleagues from Center for Health Psychology, Professor Usha, and already, as I mentioned, Professor Ramesh Kumar Mishra, Head Center for Neural and Cognitive Sciences. He has joined, and young MD scholars like Sharada and all who joined in this lecture, Dr. Vairamuthu, and our research scholars, and few more interested participants in this particular topic, then the scholars who are watching the lecture live on the YouTube, I welcome you all, and also Dr. Vedantam Srinivas Iyengar, an eminent scholar in Sanskrit who joined today. And once again, I thank Professor Antonella for accepting the invitation, and I welcome you, madam, once again. Thank you very much.
Thank you.
Thank you, sir. I request Dr. Ramya Arnath, PhD research scholar at the Department of Sanskrit Studies, University of Hyderabad, to introduce our esteemed speaker.
Good evening, one and all. It's my honor to introduce our guest speaker, Professor Dr. Antonella Delle, Fave, specialized in clinical psychology. Madam is Professor of Psychology at the Medical School of University of Milano, Italy since 2005. She started her career as Assistant Professor in 1992 from IULM University, Italy. Her research interests primarily include the study of mental health indicators and daily experience fluctuation across cultures and among individuals experiencing conditions of diversity and adversity. She is involved in research and intervention projects focused on the promotion of psychological and social resources among persons diagnosed with chronic diseases and their family caregivers. After acquiring master program in Ayurveda for physicians from the School of Ayurvedic Medicine, Ayurvedic Point, Milano, and SNA Aushadhashala, Thrissur, Kerala, she conducted research studies aimed at integrating the perspective of Western medicine and psychology with the approach of Ayurveda to psychophysical health and disease. Her scientific contributions include more than 72 papers in international peer-reviewed journals. She authored and edited 6 international books. Few books in her credits are Psychological Selection and Optimal Experience Across Cultures, Positive Psychology for All, Introduction, Concept and Application in School Age, Well-being and Cultures, Perspectives from Positive Psychology, The Exploration of Happiness. She has contributed about 65 chapters in international peer-reviewed books, has delivered keynote address in more than 37 symposia. Her academic and administrative responsibilities at University of Milano include Director of the Degree in Health Education, Head of the Department of Preclinical Science, Chair of Committee of Bachelor Degrees in Health Profession, etc. Some of the teaching and training activities include general psychology and cross-cultural psychology in undergraduate and master courses at IULM University and University of Milano, medical specialization programs, PhD program, refreshing courses for health professionals at University of Milano, Oslo Summer School in Comparative Social Sciences and full-time course in Positive Psychology at the University of Oslo. Her honorary membership include Fellow of the International Positive Psychology Association. She held the position of Adjunct Professor at Amrita Vishwavidyapitham. She also held dignitary roles in scientific associations like International Society of Quality of Life Studies, European Network of Positive Psychology, etc. Madam is currently Editor-in-Chief of the Journal of Happiness Studies, Director of Book Series Cross-Cultural Advancements in Positive Psychology and Happiness Studies. Madam, we are blessed to have you among with us for today's Tadvidyasambhāṣā. Thank you.
Thank you, Dr. Ramya, for the introduction. We are looking forward to your lecture, and we have been doing so for the past few days, ma'am. So now we are Professor Antonella Delle, Fave. We are all ears for your lecture. Please go ahead.
Thank you. I try to share my screen first. What is happening? I cannot share it.
Yeah, maybe you can share the screen and go to the tab to the presentation. Probably
Yes.
that might.
Okay, let me see.
Do you see the share button over there?
The presentation is open. Let me see whether I can. Yeah.
From the
Can
Google
you
Meet.
see it?
No, I think, did you get the share button in the Google Meet?
Yes, yes.
Okay. I think it's there.
Yes. Okay, now I can see it.
Mm-hmm.
Okay. Is it visible?
No. Now I think, yeah.
Okay.
It has appeared. Correct.
Okay. So I am really grateful for this invitation, and I hope you will not be disappointed, because I understand that I am talking to people who are much more expert in Ayurveda than me. And therefore, I immediately start asking, please apologize if I say something wrong. Both in terms of pronouncing terms in Sanskrit, and both as providing some information which is not correct. But I have been learning Ayurveda from Italy, and I have been also working basically in the domain of health psychology and for most of my life. So I am still a very beginner in the domain of Ayurveda, and I really would like to stress this aspect. What I will try to do is to identify some of the core concepts of Ayurveda as concerns mental health, which I think could be helpful to highlight differences compared to the Western view of mental health, or let's say to the biomedical view of mental health. And also to show some possible cross-fertilization of contents and of approaches to mental health between these two views of life, we could say. So Ayurveda is not just a Shastra, in my opinion. As it relies very clearly on Darshana. As an applied science, however, it is not sticking to one single darshan, because, for example, the Ayurvedic view of the evolution is grounded in Samkhya, but at the same time, Ayurveda has to do with people, with bodies, and with treatments coming from the natural world. And so it also derives a certain part of its view from Nyaya and Vaisheshika, concerning especially, for example, the property of the plants and how to prepare different formulations, what are the physical effects of certain treatments on the body. And so it is, at least from my opinion, as a Western student of Ayurveda, an interesting combination of different darshanas, which are, however, not contrasting each other, but rather complementing each other in service of a complex discipline like treating life, promoting health, and preventing disease. There is a whole history of Ayurvedic treatises, and we know that they were updated with the centuries. But it is true that I personally experienced myself the basic pillars of Ayurveda contained in the Charaka Samhita and the Sushruta Samhita are still the basic pillars of Ayurveda today. And this is already an interesting difference from Western medicine. and also Western psychology. We are trying to continuously update our knowledge, but this is also due to one basic difference from Ayurveda. Our knowledge, medical knowledge and psychological knowledge, is not grounded in darshana. It is really a shastra. It is based on the view of the body and of the mind as natural objects that can be understood more and more deeply through increasingly refined technologies, and basically amoral, disjunct from ethical principles or historical principles. So I think this is one of the basic differences, even though we are struggling very often with ethical issues, especially when technology is going so far that we can allow children with extremely severe disabilities to survive in conditions that will never allow them to run an independent life. Or we are allowing people with severe degenerative diseases to survive with the help of machines and technologies, sometimes without them being able to say, please stop, it is enough for me. So we have this dilemma in the modern medicine, that technology is practically giving us no limitation in terms of how to biologically extend life, but we also don't have any really strong darshana guiding the ethical guidelines we are trying to develop in order to make decisions. So I think this is a very important different aspect that differentiates modern medicine and modern psychology from Ayurveda. Another basically different aspects, which is partly related to the previous one actually, is that according to Ayurveda and according to Samkhya and to the darshana on which Ayurveda relies, reality stems from unmanifest principles which are related to consciousness, and consciousness manifests itself before matter, before at least gross matter. And therefore, the principles of mind appear before principles of body. This is an interesting difference because what we know from the study of scientific evolution starts from cells. The appearance of material small principles, material principles of life, which become more and more complex and give rise to nature until human species. While this view of Ayurveda, where the consciousness has a primacy compared to the matter, is interesting and provides a completely different perspective concerning the role of the mind in health and disease. And also one of the most interesting aspects, in my opinion, in Ayurveda is, which is again based on the darshan, is the fact that when the cosmic intelligence, Mahat, becomes, let's say, incarnated, individualized in the ahamkara, then the ego stems, and from the ego, this individualized intelligence tends to lose its connection with the higher levels of consciousness, becoming more and more embedded in nature as manas, sense organs, and till the development of the real material body. This is interesting. Why? Because I think, first of all, this view allows to ascertain that there is a consciousness in any living being. It is not, of course, simple panpsychism, but the intelligence of nature, which is now more and more frequently acknowledged also in natural science. And also the fact that the power of the mind on the health of the body is declared since the beginning. The Mahaguna, the three basic qualities embedded in this evolution from the unmanifest Prakriti to the Mahat and the Ahamkara and so on, are basically the subtlest qualities of the universe. And this is another difference from Western science. Usually in Western science, we don't reason about qualities, but we usually reason about quantities. And it is true that the fact that, for example, the Mahaguna are in balance or not depends also, let's say, on the proportion of the Mahaguna. But it is not the goal of Ayurveda to measure quantitatively how much, which is the percentage of Rajas and Tamas and Sattva. It is more how they harmonize with each other, with one of them which can be stronger in a certain condition, like, and this is what happens, for example, as far as I understand, with the evolution from the unmanifest to the manifest, when Rajas is taking as energy the role of pushing towards the articulation of the manifest world. Again, even in when we go to the body features, we have qualities rather than quantities, and any piece of matter shows specific qualities. In Western medicine, we have completely forgot about qualities. We are not anymore able even to notice qualities in our examination of patients, for example, or anamnesis of patient symptoms, or interpretation of any kind of test, blood test, or even neuroimaging. We are very much grounded into quantifying everything, losing the perspective of quality, which is actually the essence of nature. And the essence of our own interaction with nature. Our sense organs interact with the environment, not really by measuring, but by perceiving qualities, colors, and textures. Our sense organs provide us with information about qualities rather than quantities. And this is very interesting. The Western science left all this basic knowledge, which is available to any human being, on the side, focusing on something which is not really, which cannot be really assessed with senses, but only with technology. And in this way, we are becoming more and more independent from technology, losing, however, the capability to observe reality with a clear and critical eye. In my opinion, Ayurveda has anticipated what we call today the biopsychosocial model by 2,500 years, because the definition of the human being in Charaka Samhita Sutrasthana is a unity of body, sense organs, mind, and self, soul, spirit, Atman. So this view of the human individual is, as I said, has been also again forgotten by the medical science in the Western history. From the time of Descartes, we have learned to split the body from the mind. And today still we are used to do this because psychology has evolved as a scientific discipline, as a discipline focused almost exclusively on the mind. While we know increasingly we are aware of the fact that this is really impossible to do. Beside, of course, and even in the description of the body, Ayurveda focused on some aspects that are not so really adequately considered in Western medicine, especially today. For example, we know that the waste products are very important to maintain health. But Western medicine is very rarely concerned about the proper functioning of excretion, of elimination of ama, of correct production and elimination of mala. We are much more interested in looking at the single organ, losing the view of the body itself, even only talking about the body, as an integrated system with different functions that need to work in reciprocal balance and harmony. The same is for Agni, for example, for the so-called digestive fire. People who have difficulties in digesting are treated with medicines which help them digest from the outside, but without solving their intrinsic problem of weakness of Agni. We don't even have the concept of Agni in Western medicine. And we even don't have the concept of dosha, the three functional systems which are the basis for identifying the individual prakriti, so the so-called individual constitution. And again, interestingly, the definition of health, according to Sushruta, is a definition focusing on balance rather than on optimization. And focusing on balance of any component of the individual, be it physical, functional, or mental, and even spiritual, because in the definition of health, prasannatmendriya includes the sense organs, the Atman, and the manas. And this shows the real relevance and contribution of Ayurveda in providing a comprehensive view of health, which is less and less taken into account in the Western medicine. And of course, if health is balanced, disease is an imbalance. But interestingly again, and this is once more interesting for psychologists or for neurologists or for psychiatrists, the primary causes of imbalance are mental. Prajnaparada, Asatmendriya, Arthasamyog, and Kalaparinama. This is another issue which is completely ignored by Western medicine, where disease, yes, now we are talking a little bit more about wrong lifestyle. If I sit too much, I will get back pain. If I eat trash food, then I will get diabetes or a high BP or some kind of metabolic problem. But this is something which has been acquired only very recently, and it is not on the top of the thoughts of doctors, even today. While this concept, there's misconduct of the person, wrong judgment and wrong evaluation of things, events, people, oneself, leads to imbalance, which ultimately leads to disease, is extremely relevant. And again, it is one of the most relevant contribution to Ayurveda, to the understanding of medicine, that should be incorporated more seriously in, let's say, the biomedical medicine. Okay, I will not enter the discussion about what are the dosha, because I think you know it much better than me. But what I think is very interesting, and it is always very difficult to explain to Western colleagues about the dosha, is that they have both bodily and mental features. So vata can be seen in the body, but also in how the mind works. And the same is for pitta, and the same is for kapha. This is interesting because this again underlies the fact that body and mind cannot be disjoined. There are some aspects, even because when we speak about movement, everything moves in the body and in the mind. And movement is the same kind of process. It can be easily generalized to any aspect which moves. Again, not necessarily focusing only on what we can see moving, we can assess as moving, but also dimensions like thought movements, which cannot be observed practically, and which is another important difference. And going to the view of human being as a unitary system, we cannot avoid speaking about Prakriti, which can explain individual differences. Again, individual with different Prakriti differ in body structure, in body functions, in body strength and resistance to injuries and external events affecting the body, and also emotional and mental characteristics. And interestingly again, what we have learned only recently in Western medicine is that Prakriti is determined already at the time of conception by the bija of the mother and the father, by the Atman, another aspect which is missing in our view. The environment in which the fetus develops. Only recently, gynecology has put attention on the condition of the womb during pregnancy. And also with the lifestyle of the mother, with the mental health conditions of the mother, and with time of conception and delivery. So this very basic knowledge has had to be conquered again from the scratch by modern medicine in the recent few decades. And from some aspects, we could think it is a bit ridiculous because knowledge is already there. And we simply ignore it coming from a different culture. And we have, in a way, to invent the wheel, because we are not able to ask other people what they already know, even if their organization of knowledge is based on different instruments or different lines of reasoning, but still circulation of information is too low across cultures, I think. There was a very detailed investigation of the individual differences based on Prakriti in Ayurveda treatises. In Charaka Samhita, for example, there is a thorough description of the body and mental features of the three basic Prakritis, even though we must admit that people showing the primacy of one dosha on the other ones are a minority. But still, sometimes there are prototypical elements and prototypes can help understand better what happens in the general population. And the same principles, the same functions that determine Prakriti are also determining Vikriti, which is imbalance. And the imbalance is a condition when one of the dosha becomes too predominant compared to the other ones, bringing, imbalance in the system. Again, we are not speaking about percentages, we are not speaking about quantities, we are speaking about manifestations in more qualitative terms. The increase of irregularity in functioning is a sign of increase in vata, and increase in drowsiness and heaviness and water retention in the body is a sign of imbalance of kapha. But again, it's a matter of observation of the individual, first of all. And this view of Vikriti, taking into account the doshas, provides, of course, a different approach to a variety of imbalances. Think about, for example, issues with body weight. We are usually treating body weight, at least in the Western, in the modern medicine view, as an issue of diet and physical activity. And we are completely forgetting, because we don't have the conception of Prakriti, we are not considering at all Prakriti. We are not considering at all, for example, the fact that a person with a strong imbalance in Vata could have an excess of food intake in order to try to compensate this imbalance. And so to increase the body weight due to the effort of compensating an excess of Vata. And sometimes we impose diets which are so restrictive that have as an outcome the increase of Vata, thus not promoting further imbalance. What is missing in the Western, in the modern medicine? I don't say Western because modern medicine is in India as well, and it has also provided a lot of good things. I'm a medical doctor myself, and I cannot deny what we have gained in the world in terms of survival, defeat of infectious disease. We saw recently the role of the vaccines for protecting people from COVID-19 pandemic, or supporting people with chronic disease with different solutions or even surgery. So there are, or chemotherapy for cancer. There are a number of merits in modern medicine. But in order to make it more efficient, it should try to find an alliance with what is known by ancient systems of medicine, because only in this way can we really build an integrated view of human health. Also taking into account that modern medicine treatments are often very expensive, and they cannot be exported everywhere in the world just because of the costs. And for this reason, trying to bring to promote an alliance between different views in order to integrate perspectives is, in my opinion, an important future avenue for medicine, and for medicine both in terms of physical issues and in terms of mental health. We know from the Vikriti, from the imbalance, that we can distinguish over 80 kinds of diseases based on Vata imbalance, 40 about Pitta and 20 about Kapha. So we know that Vata is the dosha which tends to get imbalanced first. And we also know that some kind of mental health expressions are based on the doshas. For example, anxiety disorders are more typical of Vata imbalance. Anxious obsessive disorders are more typical for Pitta, and depressive symptoms are more typical for Kapha. So imbalance. So it is possible to identify a connection between dosha imbalance and mental health issues. And recently there were interesting studies trying to look at the interrelation between the gunas, the Mahaguna, and the Tridosha. Because there is in Ayurveda a very thorough description of the Manasa Prakriti, the Prakriti of the mind, based on the interplay between the three gunas, which are distinguished. Every guna includes different kind of, let's say, typologies. The sattva, the rajas, and the tamas. And recent studies have shown that there is a very clear, a strict correlation between the Manasa Prakriti and the Dosha Prakriti, which is not surprising, basically, because since the body comes from the mind, the structure and the balance of the guna at the mental level gets reflected in the balance of the guna at the of the dosha at the body level. I think this is this could be one problematic issue. The study of Manasa Prakriti, because as they are structured in the Ayurveda treatises, they are very much loaded by, they are very much value-laden. So clearly identifying positive features in the sattva and very negative features in the tamas. So if we think about collecting questionnaires among people, self-reported questionnaires about their Manasa Prakriti, I am not sure that people would identify with certain characteristics of Tamasa Prakritis, even though maybe in some kind they have some of these tendencies. So I think the tricky issue of using the Mahaguna and the related components in investigating mental health through questionnaire is exactly this. They are very much value-laden, and people prefer not to identify with negative tendencies. I think this could be an issue. Interestingly, in my opinion, is that any mental disorder, if untreated, leads to an increase of tamas, which is something that we know very well from psychology. Any kind of mental disease, when it degenerates in severe conditions, goes towards a disruption of processes, be them at the body level, at the mind level, at the intellect level. So I think this is again another very important observation derived from Ayurveda. Looking at what we know from the Western definition of health, we know that actually health is defined as a state of physical, mental, and social well-being. So in 1948, we reached this definition by the WHO. But if you think 1948 is about 80 years ago, while Ayurveda had this knowledge many millennia ago. This is surprising that only 80 years ago, the world and WHO, of course, is Western-based, really reached the conclusion that health includes physical, mental, and social components. And when we go to mental health, the definition of mental health currently accepted by the WHO is still under debate, but it raises issues as concerns, let's say, conceptualization and treatment. You can see here this definition in which mental health is a state of well-being. Who knows what well-being is? It is not defined. In which individuals are defined as mentally healthy based on what they do and not on what they are. They have abilities, they cope with stress, they work productively, and they are also contributing to the society. What is there anything mental here in this definition? No, this is a behavioral definition of mental health. It is what people do, not what people are. Again, we are reducting mind to the body, to the behavior. This is another problem which is related to the fact that while in the Ayurveda conception, before reaching the mind, which is, let's say, the hub connecting the external world with the internal world and the sense organs, there are many layers. There is the Atman at the individual level. There are the 5 koshas, which clearly define. For example, we don't have in the modern scientific psychology view the distinction between Mano-Maya kosha and Vijnana-Maya kosha, and even less with Ananda-Maya kosha. The mind is the mind. That's all. It's one single organ doing everything, mixing up everything. And you can understand then why we are identifying mental health with action. Because we are not able to distinguish in the mental processes these fine-tuned levels of complexity and of deep consciousness, which comes from the darshana and which Ayurveda has included into its understanding of human function. What we are doing now in psychology is the effort to speak about, to define mental health in positive terms. Even today, when we were speaking about mental health at the beginning of this talk, we always think about, in fact, we refer to mental disease, depression, social isolation, anxiety syndromes, panic attacks. Mental health is a list of disease, is a list of problems. But how can we define mental health? If we move from the definition of Ayurveda, prasannat mendriya mana. What is prasanna? What is this condition of contentment and peacefulness and balance of the mind? What are the ingredients of this mind balance? Psychology in the last 20 years has tried to identify dimensions of positive mental health, which are necessary to treat mental disease. Because like for physical health, we need to identify what are the healthy principles, like the dosha, for example, and then see what happens when they get imbalanced, when the vikriti starts moving from the prakriti, from the balance. How can we understand mental illness if you don't know what is mental health? How can we treat mental illness if we don't know what is mental health? We can only try to reduce symptoms, but we cannot say that symptom reduction is mental health. It is absence of symptoms. So and I am also part of this huge movement of positive psychology, which is trying to define mental health in positive terms with a set of indicators of positive functioning. And I will not go into details here because we don't have time. But we are trying now to provide, from the Western psychology point of view, from the modern psychology point of view, a definition of mental health, which is a list of positive indicators. Like we know that, for example, a positive indicator of physical health is a good samadosha or samagnesha, or malakriya. And we can say that when there is something going wrong with dosha or imbalance, then disease is starting. The same we should be able to do with mental health. And we are still on the way in trying to better understand also with the cross-cultural studies, what are these indicators of mental health. By now, the best model, the most comprehensive model we have identified is this one, which I present here. The concept of mental health as flourishing, in which people report positive psychological functioning in terms of setting purposes and feeling of autonomy and being evolving towards the better, accepting oneself, having positive emotions and accepting the environment and the society around us. So these are some components that seems to work very well in studies across different nations. But again, they are really necessary in order to prevent mental disease. Otherwise, we will only look at people, we will only take care to people when they show negative symptoms. And in order to prevent a disease, we need to know what is mental health. As concerns, I would really like to think about developing a conceptualization of mental health which brings together this view of flourishing and the Ayurveda conception of mental health. Nothing is available from this point of view. And I think I would be open to a brainstorming in order to see how to join the perspectives in developing a model of positive mental health. As concerns personality, we have tried to see whether there were some convergences between the concept of personality in the modern psychology based on the so-called Big Five characteristics that were not based on darshana, not identified based on a thorough philosophical view, but simply collecting descriptions of people around the world and seeing which were the characteristics that were more often quoted and more often typical of individuals. And so we came to these five so-called Big Five characteristics, big factors: extraversion, agreeableness, conscientiousness, neuroticism or emotional instability, and openness to experience. And what we saw, we tried to look to collect the data among a big group of people, trying to see whether their personality features could match with their prakriti features, self-reported prakriti features. Out of this big group of people, we selected participants who reported a prevalence of one dosha in their description of Ayurvedic prakriti. And we saw that there were very interesting differences. So apparently, both taking into account the physical structure and also the mental components. So the prakriti showed very nice convergences and very nice consistencies between body and mind features in the expected direction, in the direction expected by the scriptures and the Ayurvedic treatises. But also we found interesting aspects looking at the personality. For example, conscientiousness, being very methodic and precise and determined and focused, was less typical of Vata compared to Pitta and Kapha Prakritis, which is not surprising. On the other side, emotional instability was significantly higher for Vata Prakriti compared to Kapha, and the same for openness of experience. So I think we should really work harder to bring together the Ayurvedic view with the let's say, modern scientific, psychological and psychiatric view of mental health. And we, at least in the West, should do more in trying to creating bridges between Ayurveda and modern medicine. I think in India there are already better examples. For example, I repeatedly visited the Amrita Institute of Medical Science in Kochi, where we can find, for example, a statue of Sushruta at the entrance of the hospital, which has very up-to-date divisions of modern medicine, but also a department of integrated medicine. And I think bridging these views and trying to capitalize on knowledge gathered from different systems and from different cultures can only benefit mankind. We need to expand our horizons, not only through objects and material technology, but also through common thinking and reasoning and sharing of views. And here I would like to close my presentation with this picture. This is a very beautiful Shiva Nataraja in front of one of the buildings of the CERN in Geneva. CERN is a center for physics and atomic studies. And they have decided to, based on what we know now about physics, to have a Nataraja there, showing that finally what we are learning from physics is, let's say, closing the circle with what the intuition of the rishis described when describing the cosmic dance of Shiva. Thank you.
Thank you, Madam, for an excellent lecture. It is indeed heartening to note the fundamentals of Ayurveda coming alive in your presentation, given your background in biomedicine. I am sure the learned audience is eager to interact with you. We now open the discussion for a question and answer session with Professor Antonella. The audience is free to ask their questions, but I request you to be brief and to the point. Thank you. Sir, please, sir. Yeah, Professor Madan,
Antonella, thank you. Antonella, thank you very much. Several points became very, very clear as you offer insights from the other side, if you can call it, the challenge between interpreting the Occidental perspective and the Oriental perspective to the same reality. You remember in 2009, we were in Milan when we raised these points with Antonio, and we discussed some of these issues there. The question I want to ask here is about the one phrase that you used about value-laden descriptors. Now, every society has a cultural history, and it has enabled strengths and also weaknesses, depending on which side you're looking at. So every society has a culture. Every culture is derived from the environment where the society has evolved. And we cannot but avoid this issue. But your second last slide talks about making the dialogue happen. And my question is about that dialogue. And before I come to the question, the other thing is understanding that is deeply embedded in language and the foundations. And you've picked up that point by saying the darshanas and how those provide the framework from which we derive all of these things. In your experience, when you look at this linguistic challenge, which gives rise then to clear thinking, do you think whether we will ever get around this Occident-Orient divide? I know Italy has done this with so many scholars who have come in the past to India, going perhaps all the way back to Marco Polo, who would come all the way together with his uncle to Beijing to learn about cultures. Italy is a special example. If we move further west towards going to Germany, going to France, I feel they are too entrenched in their positions to accept anything new. Phrasing this very undiplomatically, to me, this seems a big problem. Secondly, the positions they have taken have also given rise to a lot of legacy costs. These are expensive societies where life has somehow got so expensive that there is no time for people to sit and think about these things. How do we make this bridge? You asked about making bridges. Do you see different ways of making this bridge happen between the Occident and the Orient? Have we reached that point? I mean, you've given us a good example of how the mental health is an issue. We can learn so much more if we look at the Indian systems. But the dialogue that should happen is inadequate. And my fear is that the entrenched position in some of the countries will not make that bridge happen. They have dug themselves into holes that are difficult to get out of. Is my perception correct? You are an exception here. Antonio is an exception here. Carmen is an exception here. And the students you bring every year to Thrissur is a small part, outlier effects.
Well, I think maybe I am over-optimistic. This is part of my prakriti. But I think that substantial changes in history have started with a small group of people. I think the fact that I am here today discussing about Ayurveda with you all is, and discussing about the possibility to build these bridges, is a sign that there is room for doing so. It may take time. Sometimes we cannot know. Sometimes there are sudden accelerations of processes because of surrounding events. Like we never thought about developing a vaccine against a virus in 7 months. Apparently, we needed years to get a vaccine, and suddenly, with the pandemic, we were able to build a vaccine in 7 months. So, and the same happens for relationship among countries. We are looking now at the complexity of the relationship among countries in this moment in the history, and how they can suddenly change due to behavior of one country or the other. So there are events in the world that can either slow down or accelerate processes. We don't know. We cannot do it. We cannot help it, but only witness them and maybe exploit them in some situations. Well, I think that despite let's say the globalization and the circulation of ideas, which has been promoted by technology, still there is a kind of compartmentalization of knowledge in many domains of human life, within the same country, across disciplines, and across countries within the same discipline, and between different worldviews. I cannot speak about Orient because, of course, I can only speak about the Western view and the Indian view, because this is the one I have learned a little bit more. But I think that in order to build, to strengthen these bridges, there should be, for example, for sure, more comparative research. And another issue is there should be more opportunities to develop some common thoughts around, for example, a specific topic, which can only be brought about by putting together people with specific expertise in both domains. And this is what we miss. Because usually people with expertise think they don't need to learn anything, and they stay in their own expertise. Sometimes young people are more open to these, and they bring new ideas to the plate. But usually this happens within a discipline more easily also for them. While I think this is a responsibility, let's say, of the elderly and expert, to make an effort and to go out of their sealed compartments, trying to humbly compare their views, but also bringing their expertise with other views. I think unless we are not, and this is not an issue only from, I think this is a common problem. And I don't think we can substitute this thought brainstorming with, just to make an example, ChatGPT. I don't think we can throw all the knowledge of Ayurveda in ChatGPT and all the knowledge of modern medicine in ChatGPT and come out with a new model. Frankly speaking, I don't think. We need to use the common pathways we have as humans to sit and talk. Humbly.
Thank you, Antonella. Thank you for bringing that ChatGPT issue into this. This is very... Thank you very much. Thank you also for highlighting the danger of a dialogue drifting towards health, mental health, in fact, being represented as a collection of mental diseases, and we need better descriptors for health, as in health, and how to do that. Thank you so much for elaborating. We will continue our discussion also. Thank you
for the question.
Thank you, Professor Madan Thangavelaji, for asking such an insightful question. The question itself, so it is bringing out all the varied factors involved, and thank you, Madam, for answering it so succinctly. Any other questions? We have Professor Ramesh Kumar Mishra here. So would you like to interact with Madam? Any other questions?
I think Dr. Usha is there from Center for Health Psychology. Yeah, I was just taking her name. Please, madam.
Good evening, Professor Antonella. It was very, very interesting to hear the, bringing in a good relationship between psychology and Ayurveda, because I'm also from the field of psychology. And I could see how both these two different disciplines sync so well together. But my one question is, whether it is in psychology, I mean, psychology is doing a lot of scientific experimentation now, but we do not have any kind of very good scientific basis for Ayurveda. And how do you think, we as, professionals should, insist on this aspect of the field, because the more scientific anything is, the more acceptable it is. So the reason for non-acceptance of some disciplines is because of the lack of the empirical evidence. So how do we propagate this is I just would like to hear from your person.
Yes, you touched a very important issue. But again, I think that it is a matter of time. Just to move to the medical domain, which is easier, there are now an increasing number of studies investigating the properties of Ayurvedic formulations in order to identify potential interactions with modern medicines, which is one of the basic problems of integrating medicine, modern medicine with Ayurveda. The risk is to provide the same patient two different treatments which nullify each other, and this is very risky, or which interact negatively with each other. And for this reason, there are scientists doing more and more studies about these interactions. But as concerns psychology, I think it is true that psychology is doing a lot of scientific work and experimental work and so on. But experimental work in psychology is basically grounded into developing adequate questionnaires and administering them to an adequate sample of participants, and having a very good statistician helping running the data and identifying proper outcomes. And also the same works for experiments properly. Knowing the methodology, it is not so difficult to develop instruments to assess specific Ayurvedic features related, for example, to dosha prakriti, or even to guna, to the manasa prakriti, using the methodologies and analytical instruments typical of modern psychology, but relying on Ayurvedic concepts. I think there is a lot of room for this kind of experimentations in psychology. And the same for identification, for example, of components of positive mental health. Measure it. How can we formulate a list of attributes, psychological attributes that describe mental health in positive terms in Ayurveda? So I think that with a thorough contribution of scholars, expert in Ayurveda, and psychologists, expert in psychology, it is definitely possible. But of course, this implies, again, a certain effort in adopting in trying to harmonize the Ayurvedic view with the modern instruments to do research. I don't think it is impossible.
Thank you. Thank you so much.
Thank you. Any questions? Any more questions?
I think Ramesh might want to say something.
Is he available, sir?
I think he's not available.
Not available.
Oh, is it?
Yeah. He has left the meeting.
Maybe any other participants? Yeah.
Yes, sir. Please go ahead, sir.
Yeah.
Please go ahead. Professor
Vinayji, thank you. Now that we have Antonella here, she's presented, she's shared her thoughts. Antonella, can you tell us a little bit on how you might shape a research project or an interaction between India and Italy, or Milan and Hyderabad, or between the university and the University of Hyderabad, between your university? Is it easy now to come up with a small project where we can enable this dialogue? And what is running through my mind is that there have been these kind of projects between India and Italy on advanced studies. So something that has happened before, could we follow something along with, so that we continue this momentum that we've gathered today?
I think it is definitely possible. Maybe it's not so easy to write a research protocol and to get it approved, because of course now we have a lot of constraints concerning ethics committees and instrument development and so on. But I don't, at least as concerns studies in the domain of psychology, which in a way do not need the use of physical treatments or, for example, herbs. We have run a study on the treatment of Duchenne muscle dystrophy with Ayurveda a few years ago. And unfortunately, it was towards its end and the COVID pandemic came. And so we had to interrupt the collection of the results and also the provision of herbs from the import. It was not anymore possible to import herbs from India. So unfortunately, the pandemic did not allow us to conclude this project. And anyway, projects based on medical treatments with Ayurvedic formulations are very complex, in the sense that, for example, as I said before, we still don't know a lot about the interaction between Ayurvedic formulations and Western medicines. And this is potentially harmful, first of all, for the patients. So we cannot guarantee that. For example, we in our experiment, in our study on Duchenne, I had the idea of selecting this typology of patient because basically they have a disease, a progressive disease affecting muscles, which cannot be treated, and they take basically very few medicaments. Only some beta blocking agents to support heart and some assisted ventilation when needed, but they are young people, basically healthy, I could say. So the problem of interactions was under control, was since the beginning. But in other diseases, it is quite an issue. And it requires a very well-equipped, of course, it would be possible, for example, to develop interventions with Ayurveda using only products which are available in Europe, which are very limited. But the issue is what we know about Ayurveda with this kind of studies.
what I had in mind, Antonella, was something maybe not quite at that level. What I was thinking was to have a study group, for instance, a study group to look at all these issues, so that our students in India and the students in Italy can discuss this more frequently. For instance, you know, I think most people on this group may know the Ayurvedic point, Antonio's work. Could we formalize something like that, you know, where the two governments agree to enable a period of discussion? Say, over a 3-year period, we will have 20 webinars, 20 discussions. So it doesn't have to immediately go into the clinical domain where there is still some tension, but a study group between Milan and Hyderabad, for instance.
Well, as concerns Ayurvedic point, you have to ask Antonio, because I am not part of Ayurvedic point. So I know them, I have studied in Ayurvedic point, but all my research activity happens at the University of Milano. So I cannot answer for him. So I don't know.
Could we, at least between the universities?
But between the universities, it could be easier because they are two academic institutions. And if we think, for example, from the psychological point of view, to design a kind of set of discussions concerning, for example, the development of some instrument for assessing some aspects of mental health understood by Ayurveda, with a collection of data in the two countries with the same instruments, the Western one and the Ayurvedic one. This would be easier, and there are also bilateral agreements between governments to support academic institutions. So it could be feasible. Of course, I speak about my own research field, which is psychology.
Once again, I think we are taking it a little beyond what I have in mind. Perhaps what's in my mind is a study group where we meet frequently, and to see whether we are understanding both sides. You know, the young students here.
Yes, we can set sure. We can identify some topics every time and then open a discussion about the different.
And before we escalate it to the more deeper principles.
Yes, it is definitely possible.
Thank you. Thank you.
And I mean, I think we don't even need to ask to our universities. We can just organize a webinar like the one organized today.
Thank you.
Thank you, Madan sir, for asking a very precise and important question. And the madam also has expressed the practical difficulties involved with that, but I'm sure there will be some common ground working there. So let us hope for the best. Any other questions to Madam Antonella?
Dr. Usha ji wanted to say.
Yes, ma'am. Please.
Yeah. In the same lines as Professor Madan was talking, you know, how these two areas like Ayurveda and psychology can come together. You know, then I think the open discussions as we think and debates over this topic could actually help students to think in those lines, because you know, this is an interdisciplinary field, and when we are discussing topics, I think there is a scope for you know, more analytical or critical thoughts to come in, and students may come up with, you know, their own you know, scientific thought. So that could be something which, you know, can open up.
Sure, I agree.
And since you are from psychology, maybe I should take this opportunity where we can, you know, there are so many questionnaires which are mostly based on the Western aspects of behavior or personality, you know, so something which parallelly can be created based on the Ayurvedic model. could be viewed in?
Sure, of course. The issue is only to adopt the right procedure to develop the items, exactly the same procedure that it is usually used for developing a questionnaire in
Psychology.
Yes. But it is definitely possible. I can tell you that I know a colleague from the Kamlesh Singh, who works at the Indian Institute of Technology, Delhi, who has developed some interesting instruments. For example, to study Anasakti and to study other typical dimensions of the mind and in Ayurveda, or better, sorry, not in Ayurveda, but in Indian psychology. So it is definitely possible.
Thank you. Thank you.
Thank you, ma'am. Madam, may I ask you a question? In Ayurveda, Sadvrita and Achara Rasayana are considered as pillars for individual health as well as for social and community health. So, how do you think these can be incorporated in largely, across disciplines?
Oh, I think they should be incorporated across disciplines because they are basic pillars for health promotion everywhere in the world, not just not just in Ayurveda. And for example, it could be interesting to think about, to look at the literature, what is available, for example, in the domain of preventive medicine, or in the usual medical suggestions provided to patients, and also see whether it could be possible to formalize them better and include them in regular treatment. I am sure it would again benefit people, both health professionals and patients.
The Ayurvedic Dinacharya is also about promotive health.
Yes, yes. And in fact, some aspects of Dinacharya have become more and more popular in the West. For example, cleaning the nose or cleaning the tongue in the morning. There are more and more people doing it.
Yeah.
Even though it is not usually prescribed by doctors. It is used by people because they feel better, but it's not a common knowledge provided by doctors.
Simple things like Padabhyanga can restore sleep. So, instead of taking medicines which are addictive, certain things can really be incorporated, and it can be, I feel, like as an Ayurvedic practitioner, I really think that there are so many things from Ayurveda which should come out in the open, and it's universal things. I'm not speaking about the herbs, and as you said, rightly pointed out, combining herbs and certain medicines could be harmful. So, but doing these things might be easier.
Sure, Padabhyanga, but also, pranayama, some basic exercises of pranayama, which are very easy, and you can do it everywhere. And but again, sometimes they are misused because people lack the real knowledge of how to use them. And this is another issue, how Ayurveda is disseminated in the world. Sometimes it's not properly disseminated.
Thank you so much, ma'am. It's been a pleasure to talk with you. Any other questions? Please, sir. Dr. Vedantam Satya Srinivasa Iyengar Garu has raised his hand. Please go ahead with your question.
Namaste.
Namaste, sir. Please ask your question.
Professor Antonella ji, Gautam Krite Pranam Sahasrani. I am share my gratitude to you, your knowledge, and my opinion to Ayurveda, it is the Changadhara Samhita says the definition of Ayu very scientifically. Pranayan Dehamakhilam, Jivayan Jatharanilam, Sharira Pranayorevam, Samyogat Ayurichyate. Here is the Pranavayu, which stays in the body at the place of Nabhi. Prana Apanadi, 10 Vayus are, depends on Pranavayu, which stays in the body at Nabhi. It goes outside of the body through Niswasa and get energy from Vishnupada. It means Vyat, from world, and it comes in the body with Uchvasa. It energy in the body and strengthen the Jataragni. These types of scientific analytical sources are in Ayurveda, or so many sources are in Ayurveda. This type of knowledge, and as you said, so many types of Ayurvedic with manas, psychological theory, it means so great purpose to the society and knowledge persons. So in this time, I am thanks to organizers and thanks to Professor Antonella to share your knowledge, which knowledge is not only for one place or one person. It knowledge is Vishwasya. So I am gratitude to your knowledge and organizers by giving opportunity to share with you. Thank you.
Thank you, sir. Thank you very much. Any other question? Anybody wants to ask any question? Please be brief with your question. We do not have much time. Then, with Professor J.S.R. Prasad Garu's permission, I would like to wind up this session, and I invite Professor J.S.R. Prasad Garu to give the vote of thanks, deliver the vote of thanks to our distinguished speaker.
Thank you, Vinyaji. Immediately, I could able to recall the statement of Descartes, René Descartes, the French philosopher, cogito ergo sum. I think, therefore I am. But I heard a scholar who was telling that I am, therefore I think. This is where the Ayurvedic perspective, comes into picture to tell about the reality of the existences. And one scholar was commenting, like psychiatry requires psychology, but not exactly pharmacology, because a lot of prescriptions are given to the patients with mental disorders, and unfortunately they are working on the brain. As per the definition of Descartes, the mind is in the brain. Probably it is like a flash, it is emanating the brain. Brain is tangible, but mind is intangible. As per Ayurveda, mind is atomic in nature. Anuttamata chaikatvam dauguno manasasprito. It is atomic in nature. At the same time, it is not multiple, it is singular. it does all actions. It looks like it has, there are multiple minds doing this, multiple actions at the same time. So with these observations, I have noted some of the points from Professor Antonella's wonderful presentation. She started to say that biomedical view of the mental health in Ayurveda, especially from the Sankhya perspective, as she has presented Prakriti Purusha, the Sankhya cosmology exclusively, because it is one of the most ancient systems of Indian systems of philosophy, because the Sushrutamrita has adopted these philosophical tenets as their basis. As she rightly pointed out, we deliberately or unknowingly ignore these kind of this sort of knowledge, especially in Ayurveda, and try to reinvent the wheel. So that is a wonderful observation. First of all, it's like an eye opener for many who wanted to work in this interdisciplinary research. Then she went on to talk about Mahagunas, the Trigunas, and at the same time, West doesn't know how to assess this. First of all, they don't know about this dosha. They don't know about the guna, because even through using sophisticated instruments like MRI and all, these things are invisible. Neither dosha nor guna can be assessed. So that is an interesting observation. And what she mentioned is they require qualities rather than quantities. That's another important observation. And she talked about Gurvadi Gunas, qualities of the matter. And Ayurveda consisted wonderful definition in the definition given by Charaka, Sharira, Indriya, Sattva, Atma, Sanyogo, Dhari, Jivita. This is like a biopsychosocial model that she has named it, so that others can also understand what they mean to say in Charaka Samhita. And she said that individual is a multi-dimensional system. That is why there is a holism involved with regard to the approach, with regard to the treatment protocol, wherever it is required. But whereas in the modern medicine, which is heavily dependent on modern science, again, which is dependent on the Western philosophy, a lot of reductionism, minimalism is seen. This is where a great gap is observed. This is where I think we need to build a bridge, as rightly pointed out by Professor Antonella, in response to Dr. Madanji's question, and also asked by Dr. Ushaji. Then she talked about Agni, another most important concept in Ayurveda. Agni Moolam Balam Pamsam Balam Moolam Hi Jeevitam. The metabolism is a very, very important aspect, particularly in context of diabetes. That is a metabolic imbalance that causes this sort of diseases. So she talked about the doshas in brief, vata, pitta, kapas. And what she observed is different prakritis have different mental characteristics. For example, the Mahaguna Prakriti, Triguna Prakriti, as Manasa Prakritis, 16 Manasa Prakritis, 7 Sattva Prakritis, 6 Rajas Prakritis, Rajo Prakritis, and 3 Tamo Prakritis. This sort of classification is not there, probably, I may be wrong, I have not seen so far in the Western approach or Western medical science. I may be excused, I'm using the word Western, maybe modern medicine, let me say like this. So that way, Madam has also mentioned about one interesting paper, collaborative research paper, in which she talked about the big fives, which are abbreviated as OCEAN, OCEAN, to remember it easily. And the important observations like conscientiousness with regard to Vata, that is lesser when compared to Kapha constitution. Then openness to exercise, etc. This Vata is having more probability than the Kapha. Such a way, these results are really encouraging for us. I think we need to do more such kind of researches. And the WHO definition about the health, the physical, mental, and social components, until 1948, this was not part and parcel of the definition of the health. That means until 1948, people were totally deprived of mental health aspects with regard to the treatment aspect. So this is where something is seriously missing, but at least better late than never. And also another observation is in 2004, WHO has published a paper, probably, or a report, reductionism of mind to the body. This is the paper talked about only behavioral aspects of the well-being. But what Professor Antonella pointed out is there is nothing related to the mental health. That is another wonderful observation. There's like doing versus being. And excellently, she has quoted about koshas. One of them is Manomaya kosha. Manomaya prana sarira neta, Veda says. And there are microchannels, Manoha srotasal. And these kind of concepts are not available in, so far, not available in modern medical science. So, and what she observed is mental health and mental illnesses are not opposite poles of the same continuum. Another wonderful observation. Until we know about the concepts of mental health, we don't know anything about mental illness, because Ayurveda initially talks about the health, protecting the health of the healthy. Swasthasya swasthya rakshanam. Atarasya vikara prashamanancha. This is what they are very, very clear. They are not treating the disease first, rather they're giving importance to the patient. I mean, the prakriti. So this is where a biggest gap is observed between the modern medical science and Ayurveda: patient centrism versus disease centrism. And the questions by Dr. Madanji, how do you see the gap, debate between Occident and Oriental? That is a very interesting discussion happened, and we enjoyed it, especially your comment on ChatGPT. That was really exciting. It's a wonderful example to understand the context in a better way. And acceptance based on evidence, as Dr. Ushaji has asked. Yes, using instruments based on modern methodology is possible. That is what assured by Professor Antonella, especially has given the examples in Prakriti, etc. So finally, we thought Dr. Madanji has initiated a discussion about the collaboration, study group and all. We thank you, madam, for accepting to form a study group. I think our students especially will get benefited because of your guidance and your expertise and experience. So these are the salient features and points from Professor Antonella's wonderful presentation. We benefited a lot from your wonderful presentation, madam. One of the audience from YouTube has commented that Vishado Roga Vardhananam, I think Dr. Anurup, his name is. Yeah, Vishada. Vishada depression is the root cause of all problems, because stress is the mother of all diseases. This is quoted in Sushuddha, he was telling. Like this, many youngsters are also inspired by your talk, and we look forward for more such fruitful interactions with these brief words. I thank you very much for kindly accepting our request to deliver a lecture in this online lecture series called Tadvidyasambhāṣā, and enlightening us with your wonderful knowledge. As Professor Satya Srinivas Iyengarji mentioned, is a great Sanskrit scholar, but trying to express his views in English. So that is what we understood. He has great respect to your knowledge. So Rigveda says, Ano bhadraha kratavo yanto vishvata. Let the noble thoughts come from all parts of the universe. This is where we are in one family. So this brings us an inspiration to work in collaboration. And once again, I thank you very much, madam. Thanks a lot.
Thank you. I am grateful for this invitation again and for the very interesting conversation we had today. Thank you.
Thank you very much. And also, I thank Professor Madanji for quite dynamic interactions. He is a great strength for us, motivator. And Professor Ramesh, my colleague, and Professor Ushaji for actually interacting with Professor Antonella ji. Thank you, Professor Ushaji, and we look forward for more.
Thank you. It's a great pleasure to be here, and a lot of knowledge that we have received from Professor Antonella. Thank you so much for inviting me. Thank you.
Thank you. And Professor H.S. Palak, he is located in United Kingdom. I'm not sure about the location, just I come to know about his, enterprise clinic in, probably I may be wrong, hospital in UK. He was there for a long time in the YouTube live. Thank you very much, sir, for joining us. And young scholars like Andrup, Dr. Radhika, Sharada, and all. And there was another member from All India Institute of Ayurveda in New Delhi. I thank all the participants and delegates and colleagues, further staff, and especially my team, Dr. Vinaya, Dr. Abir, Dr. Remya, and Subhashish, and Girija, all who helped us to get this through in a proper way. And with all our collaboration only, such an event would have been successful. So once again, I thank you all. And I thank once again Professor Antonella. We look forward to you for our guidance. Thank you very much. Thank you. Namaste all.
Namaste.